Time now for the first of our possible talks, shorter TED-style talks from your colleagues sharing their approaches to digital health during this pandemic time. Patricia Forts is Deputy Chief of Innovation and Strategy at Harvard Pilgrim Health Care. She led the formation of the Center for Innovation at Harvard Pilgrim, and her focus today, the dynamic and unique initiatives Harvard Pilgrim has implemented to improve the health of its members. Patricia?
Thanks, Mike. Hi, I'm Patricia Forts. I'm the Deputy Chief of Innovation and Strategy at Harvard Pilgrim Health Care. I'm really happy to be here today to talk to you about some of the work we're doing to drive innovation forward at Harvard Pilgrim. Healthcare, and in particular healthcare delivery, is changing exponentially as new technologies emerge. As a leading national not-for-profit health insurer, Harvard Pilgrim is committed to ensuring our members have access to the care and services the best care and services that we can make available. Innovation is a core value for our organization, and we're committed to innovating alongside with those in the healthcare industry. To that end, several years ago, we formed what we call the Center for Innovation at Harvard Pilgrim. I'm proud to lead a team of individuals that spend their time researching, evaluating, testing, and implementing new and innovative healthcare solutions. Through partnerships with leading healthcare organizations, digital health incubators, healthcare researchers, and others, we are championing new and innovative solutions to bring to market. Today, I'd like to tell you a little bit about some of the exciting work we do at Harvard Pilgrim. We all know that digital technology is driving exponential change in healthcare. It's driving exponential change in all of our lives in many ways, from the way we order food, to the way we order transportation services, and the way we communicate with one another. We're all looking for affordability, convenience, connectivity, and access. And this is as true in healthcare as it is in all other spaces. Healthcare in particular is changing rapidly to accommodate these new consumer demands. In fact, in 2019, there were over 50,000 healthcare apps on the market, with new apps and new solutions coming out every day. And this year, this is exacerbated even more by COVID-19 and the pandemic that we're all living through, as we try to continue to receive healthcare, but to do it remotely through telehealth, through text messaging, and other ways of communicating with our providers. It's just a whole new world in healthcare. So all of this makes for fertile ground for insight, improvement, and innovations in the space in which we're working. Harvard Pilgrim approaches innovation in 4 specific ways. The first is through internal collaboration. We really want to involve our employees in the work that we're doing in the innovation space, because they're the ones who work most closely with our members, our brokers, our employers, all of our customers, and they have the best understanding of their needs. We use crowdsourcing tools, member journey mapping, human design thinking, and other tools to foster ideation within Harvard Pilgrim, and we do it really successfully. The second way we drive innovation is by partnering with startup incubators, programs like Mass Challenge Health Tech, other health systems providers and payers who are designing and testing new innovations. We work with them collaboratively to see if we can implement their programs and services in our organization. Harvard Pilgrim also invests in promising technology solutions as a way to help bring them to market more quickly. And lastly, one of my favorite things is the pilots that we run for our own members, for our own employees, to test these emerging technologies, platforms, and services. We need to develop a deep understanding of how they will impact our members. How will they be incorporated into the systems, programs, and services that we offer? We run these pilots on a regular basis. We have numerous initiatives currently underway at Harvard Pilgrim, and I thought today I would tell you about 3 of them in particular. At a high level, here are some of the programs that we're running. As you can tell, most of these are tech-enabled. They're really impacted by the rapid advances in technology. We have everything from a teledermatology solution that allows providers at the primary care practice level to use 3D technology to capture images to send remotely to specialists in the dermatology field to be read. And then the specialist can guide the primary care practitioner on how best to treat or to refer that patient. We're evaluating the concept of virtual first primary care. Will members or patients choose to go virtual for as much care as they can? A year ago, this concept was pretty inconceivable, but this year, it's not that inconceivable that we might want to use telehealth services as our first level of care with our providers. We're piloting a really innovative substance abuse recovery program that uses contingency theory or incentives and rewards to help those in recovery really continue along the path, along the journey that's mapped out for them. It reinforces doing drug testing. It reinforces going to therapy. It reinforces 12-step programs or whatever the individual and their practitioner might have set up as the best course of treatment. And it's all done through their digital app. So these are just some examples of some of the programs we have underway at Harvard Pilgrim. But let me take a deeper dive into 3 that I thought you would find most interesting. One of the programs that I thought you might be most interested in hearing about is our Hospital at Home initiative. Hospital at Home is an evidence-based, value-based model of care that was developed by practitioners at Johns Hopkins back in the 90s and has been tested over the years and various variations of the model. Particularly during COVID, it's really become more and more interest to bring this type of a solution to the market. Essentially what happens in a Hospital at Home program is a patient is offered the opportunity, a patient who would otherwise have to be treated in the hospital for an acute condition, is offered the opportunity to receive the care in their home. Frequently, individuals who have COPD, CHF, known chronic conditions, might be a UTI, infections, etc. Frequently, they end up in and out of the hospital, and they're well known to their providers. So in the case of Hospital at Home, the provider says to the caregiver and the patient, how would you feel about receiving your care in the home? We can bring a team to you to monitor you regularly, to grant you continuous access to your providers, just like you would have in the hospital, to provide the services, the wraparound services, be it lab or x-ray or DME, etc., but to provide them all in your home, in the comfort of your home. And for those individuals who elect to go this route, as soon as they transfer back to their home, they're met by a logistics team who set up vitals monitoring, audio and video communications, the necessary emergency response system, mobile diagnostics, etc. There's a care team. Usually a care team consists of a nurse practitioner, a social worker, but they can be expanded to include PT or OT and other practitioners. And they come and they provide the services that are necessary to this patient. What's interesting is we're seeing really positive results in terms of patient satisfaction. Patients obviously and caregivers themselves really prefer to be treated in this model in their home. Interesting also is that we're finding there's increased physical activity for those patients who choose to stay home. So rather than being in a hospital and lying in a hospital bed all day, they may be getting up, going to the restroom or going to the kitchen to grab something. And so they're moving about a bit more. Most importantly, we're seeing improved outcomes, decreased costs, and decreased future hospital readmissions. So these are all really positive results that we're seeing through the pilots and the work we're doing with 3 or 4 provider groups in testing out this Hospital at Home model of care. The second initiative that I thought would be really interesting to talk a little bit more about is a pilot that we've just launched in the last few months with a company called Kaya Health. The impetus behind this was our desire at Harvard Pilgrim to find ways to help patients with chronic pain, to find ways to better manage that pain, and to really reduce their reliance on opioids in particular. So Kaya is a digital app. You download it on your phone, and it has it's considered a multimodality app. It has 4 different ways of treating a patient with chronic pain. In this case, in particular, it's chronic back pain. The first modality is just education, helping people to understand what pain is about, how they can overcome their pain, and how important it is, physical activity is to helping reduce pain, is the first modality in which this app can be used. The second is customized daily training sessions or regular training sessions. This to me is most interesting because Kaya uses AI-driven technology to actually plot your main body parts. And as you're doing the exercises or activities, it can track your movement and it can pause the app and give you advice or guidance on how better to adjust yourself so that you're getting the most out of the training activities, much like a physical therapist would do right in their office. The third facet of this training is mindfulness and stress relief, because we all know if you can just relax and work your way through the pain, many times it will subside. And the fourth is access to coaches, individual coaching sessions, whether synchronous or asynchronous, to understand better from the coach how to deal with pain. So as I mentioned, this is a pilot that we've just launched. We're hoping to engage about 300 patients. We're about halfway there right now. And our goal through this study is to understand, A, will patients even use this type of an app for this kind of care? Will they engage with it regularly? And will they engage with it over time? You know, everything's new and exciting. You use it the first week or two and then you stop. So will they retain this information? Will they continue to come back? Second thing we want to understand is impact on pain, of course. And we're measuring that both through self-reported pain measures. So, you know, on a scale of 1 to 10, how is your pain today? As well as by looking at the individual's downstream claims for pharmacy and pain medication. Our goal, of course, is to reduce the reliance on pain medication for these individuals. And then we're also interested in, does it impact other medical services? Is there a reduced need for PT, OT, chiropractic care, or even potentially hospital-based surgery? So all of this is part of what we're evaluating for those 300 or so people who join this pilot. And we expect to have the results in a year. Great example of how digital technology is being used to really change the healthcare delivery landscape. The last program I thought I would talk to you about this morning is our Pharmacogenomics, or personalized medicine study. Pharmacogenomics is the study of how genes affect a person's response to drugs. And in this study, we're particularly looking at how pharmacogenomics can help primary care doctors treat patients with depression. Our goal is to see how the doctors incorporate this type of testing into their practices. We're looking to conduct about 500 tests with a number of providers throughout our system. We really want to understand what the impact of this is on the provider's engagement with the testing itself. Do they use it? And does it help inform the decisions or the treatment that they recommend? How do they incorporate it into their practice so that they need to recommend it to their patient? The patient needs to go home and do the test. The results come through. They get guidance from a pharmacist, and then that guidance helps guide whatever treatment the provider recommends downstream. So what's the impact on the process flow within the practice for that? How does it impact the provider's relationship with their patient and the patient's medication adherence? So all of these things will be studied through our partnership with Harvard Pilgrim Institute and OptumRx, so that we can get a deep understanding of how pharmacogenomics and personalized medicine improves healthcare outcomes. So in conclusion, I just want to say I am a huge believer in the power of healthcare innovation. From artificial intelligence to robotics to virtual reality and mobile technologies, there are so many forces changing the healthcare landscape today. And our goal is to understand these forces and to understand their impact on our members. At Harvard Pilgrim, we're all working diligently to ensure our members, their families, our customers, providers, all have access to the best tools we can provide to navigate the complex healthcare system. Our ultimate goal, of course, is healthcare outcomes. We want to ensure that our members are getting the best healthcare outcomes. This is really important to us and critical to our mission to serve patients and communities. I thank you for your time today. I've really enjoyed having the opportunity to tell you about healthcare innovation at Harvard Pilgrim. Thank you.
Thank you, Patricia, for sharing your valuable experiences at Harvard Pilgrim Health Care. Time now to engage for 15 minutes of networking. Just click on the Find Matches button and follow the prompts. It's speed networking. You'll quickly meet several people one at a time. When we come back, the latest on the state of investing and funding in the age of COVID-19.